Good morning. Today we'll be talking about thyroid health and you. It's important that we know about the thyroid. Good morning, Prof. Afọlábí and Ìruoma and Esther. It's a pleasure to have the three of you here on the program today to talk to us.
Good morning. Thank you very much.
Good morning. Thank you for having me on the show.
It's always a pleasure. Good morning. Yeah. So, Prof, if I can start with you, I'd like to just, just let people know, what is the thyroid and why do we need to know about it?
The thyroid gland is one of the special glands in the body we call an endocrine gland. It's located in the frontal part of the neck. It is shaped like a butterfly to the layman or to the shield, after which it is named. It's just below the Adam's apple, it's called the thyroid cartilage in the medical term. So we may also have Adam's apple, never mind. But the thyroid gland is in the frontal part of the neck. Yes, there you are just touched. It's almost shaped like my bow tie also. And when I wear my bow tie, people say that, oh, it's my field, that's why my bow tie. It has two lobes and a part joining the two lobes together. Its function essentially is to produce two chemicals we call thyroxine. And the chemicals affect almost all functions of the body, from the head to the toe, including our heartbeat, how we digest food, how the food is used by the body, how our body is able to generate heat, how we're able to, our heart beats very well, our thinking. So there's no part of the body the thyroid hormones do not affect. So it's a central organ in the body, and apart from the other organ that is controlling it, we call that one the pituitary gland, which is in the brain. That one in the brain is what stimulates the thyroid gland to function very well. So the thyroid gland, in essence, produces two hormones whose functions affect all systems of the body. And you can have a situation whereby it is functioning normally or it is functioning abnormally in two ways, not functioning enough and over-functioning. I think today we are focusing mainly on the what we call the over-functioning type of disorder, that is the hyperthyroidism, when it produces excess of the hormone, and they manifest with various signs and symptoms, which we then call thyroid toxicosis. Thank you very much.
Thank you. It's always wonderful having a prof with us on the program, because you are able to even talk through the entire program without a break. So yes, we're talking about the thyroid. We're going to focus on the hyperfunction, which you call thyroid toxicosis or hyperthyroidism. But we need to also be aware that it can underfunction, and that will be low thyroid or hypothyroidism. But if you can just give us some signs and symptoms, so people have this, and it's very interesting because just the other day, somebody sent a WhatsApp into the group. They said this woman, they could see, it was a doctor, she could see an artist had been talking on television, and she just make the diagnosis of an overactive thyroid just by watching the woman, just by her visual, just what she looked like. But there are a lot of people who still don't know that they have a thyroid problem. So can you explain a bit more about that overactive thyroid? What are the kind of signs and symptoms that people have that should make them think that this is something I should go to the hospital for?
The commonest manifestation of thyroid disorder is a swelling in the front of the neck, mentioned earlier on. But for thyroid toxicosis, the signs and symptoms may appear even before the swelling appear. And this is where it is important for you to be aware of the symptoms. The symptoms are what the individual will complain of to the doctor, while the signs are what the doctors will detect when the patient comes to us. One striking feature is that because the thyroid gland is producing excess hormone, the body generates excessive heat, so that the patient will have what we call heat intolerance. Even if somebody is in the air conditioner, air conditioned car or the room, we will still be feeling unduly hot because the body generates beating too much. Gestation is that the heart may be beating too fast, pumping as if it's going to come out of the chest. Then the individual, because it's overactive in terms of metabolism, may be eating more than necessary. Somebody eats, before you know it, has taken biscuits, another snacks, and despite all this eating habits, we still be losing weight, because as soon as the individual eats the food, the body burns it off. So it's paradoxical that somebody who eats so much will still be losing weight. And then because of that, the individual passes feces too many times in a day. It doesn't have to be watery like we see in diarrhea or dysentery. It will just be passing feces many times in a day, because the intestinal tract also is hyperactive. The brain, the individual will not be able to sleep very well. There will be so much anxiety, and some people have the anecdotal story of people, they also have their fingers, tremulousness of the finger, of the hand, to the extent that for a lady, they even be dropping dishes in the kitchen, the washing plates, just break things as it were. Then there will be affection of the hair as well, hair loss, the fingernails will become brittle. And for our women, it may affect the menstrual cycle, that they may not be able to menstruate regularly. And by extension, that may affect the fertility of the woman as well. So these are some of the manifestations of hyperthyroidism. The central point is that the function which the thyroid gland performs normally is now in an overdrive. The individual is anxious. And for a particular type, which is the commonest type of thyroidopsychosis, the eyeballs come out. They protrude, because there are some things deposited behind the eye that make the eyeballs to come out than normal. It's not a matter of this runs in our family that we have big eyeballs. The eyeballs will be so much out at a later stage, the individual will be so much worried because it may affect the sight of the individual. So from what I've said so far, I can see that it affects almost everywhere, from the hair to the heart to the intestinal tract, producing too much heat, the neck swelling, the menstrual irregularity, the fingernails and the toenails, and tremors that makes somebody to drop the plate in the kitchen, and the heart beating so fast, and pumping as if it's going to come out of the chest. Those are the usual manifestations of thyroid toxicosis.
No, that's actually very interesting. And I actually know of a particular case of a gentleman who had tremors and went to see the neurologist, who then did, his test, found he had thyroid toxicosis, treated him, and then his wife got pregnant. So it actually affects the men as well, because they had been suffering with infertility, I think about 5 years. And then when he was treated, it just happened naturally. So it's so important that these things are recognized, because they can have quite a profound effect on people's lives without even knowing it. You can imagine a person who has it. Important that we take these into consideration and deal with it as required. And how do you make a diagnosis? It's very straightforward, isn't it, Prof?
It is, for those who know. But otherwise, referring to what you said earlier on, there are patients who have gone to several doctors. Unfortunately, they are not able to pick up these subtle symptoms. But the other thing that may cause what I talk about, you can imagine a middle-aged woman going through menopause, menopausal symptoms as well, the heat and the flushes and so on and so forth. Oh, they may say this is due to menopause. So, but for a doctor who knows and looks carefully with the symptoms of weight loss, eating too much, that will not be called the menopause. The eyes protruding will not be called the menopause. So when we examine the patient, you see the neck swelling, the heart rate will be fast, and then look at the nails, look at the eyeballs in a special way. And then what will clinch the diagnosis eventually is the blood test that we run on these individuals to measure the level of the hormones in the body. The hormone level will not lie unless the laboratory is not very good. So when we do the hormone level, the three of them, the one produced by the brain, the thyroid-stimulating hormone, the one produced by the thyroid gland, T3 and T4, will show the values that will make us to interpret appropriately. That this individual is hyperthyroid, producing too much thyroid hormone, or this individual is not producing enough, or is producing normally. So it's not all people who have neck swelling that have thyrotoxicosis. It's the hormone level that differentiates them from each other.
No, and they do say that this issue of hyperthyroid is associated with autoimmune conditions. Is it the hyper or the hypo? Which one, or is it both?
Yeah, both are actually affected. When we say autoimmune, it's like the body produces some substances that are fighting against its thyroid gland. So initially, when it does that, it may cause thyroid gland to hyperfunction such that it produces excess hormone. So the great disease I mentioned earlier on, the one with proteinuria ball, is an example of autoimmune disease. And there's also autoimmune thyroiditis, in which the body produces substances that make the thyroid gland to get sore or inflamed and maybe a little bit painful. And after this process of thyrotoxicosis in the individual, the cells may be destroyed by these substances we call antibodies, and then the individual becomes hypothyroid. So it's a spectrum for the autoimmune diseases. It can range from hypothyroidism to just inflammatory, which hormone level will be normal, or hyperthyroidism when it's stimulating thyroid gland to produce excess hormone. So the body can actually fight itself, let's put it that way, by producing substances against the thyroid gland.
That results in different kinds of conditions. Thank you very much. So Iruoma, thank you very much for coming on the program. Can you just remind us about your organization again?
Okay, my name is Iruoma Ofortube. I am the founder of Thyroid Awareness and Support Initiative, established in Nigeria. We basically create awareness on thyroid health and also support people that are suffering from thyroid disease.
Thank you. And we have such a person, someone who has suffered from thyroid disease and has overcome it. Esther, can you tell us a bit about how you were affected, how your thyroid was affected?
Let me first of all introduce myself. I am Mrs. Esther Iduh. What took me to the hospital in the first place was different. I never knew that I had thyroid disease. I went to the hospital because I was having palpitation, serious palpitation. That was what I went to the hospital to complain. So the doctor now asked me, when did you discover the swelling on your neck? That was how I knew that there was even a swelling on my neck. I never knew. So when the doctor examined me and saw everything, that was how I started my journey of getting a solution to the thyroid problem I have. While I was having the thyroid issue, the symptoms, my own symptoms is, at times I feel like fainting, I have palpitation, I have panic attack. I cannot sleep in the night. I'm always scared of sleeping because I will always dream that I'm in a war zone. So anytime night is coming, I will be so scared. Wow. I don't sleep in the night. And another one is, like I discovered from my own that thyroid also affects the bladder.
Oh,
I frequent the restroom, even at night.
Okay.
So I had panic attack, frequency of the urine, and that's heat intolerance. The heat intolerance was much, very, very much. When the heat comes, I will be looking for where there is water to go and put myself inside the water. Plus the swelling of the neck.
Okay, thank you.
I get tired all the time when I do anything, or if I thought I would wake up in the morning for me to be okay, it seems as if I have done a big work.
And you just gotten up.
I've done a lot of things. Yes.
Yes.
So I don't even know how to explain how my body feels.
No, we understand. We understand. Iruoma, you had also suffered, and that's one reason why you started your foundation, if I recall. You also suffered from hyperthyroidism. Did you have
Yes,
similar symptoms, or was it the same?
I had more than the similar symptom because my own, apart from all she mentioned, we talk my own, my mental health was totally wrecked because of the anxiety. At times I was depressed. At times it would be, once this heat intolerance comes, it will just come from my head down to the body, and I will start feeling weird and acting weird as well. I was easily irritated, getting provoked, getting angry at no provocation or even the slightest provocation, looking for people's trouble, always looking for where to hang in and be making noise and all that. So, and the palpitation, it also induced high blood pressure in me as a then. Yes, I started having high blood pressure, which I had never had any history of high blood pressure. So the heat intolerance, palpitations, that one is nothing to write home about. And in the course of that, people began to run away from me because I was acting differently from the way I was acting. Nobody was interested in asking what was wrong with me. Rather, they were just avoiding me like the plague because of the sudden way I changed. People started, it became an abuse. People abused me. I was this, I was that. And at the same time, I changed. It changed my color from fair to dark. And it was a terrible, it's just a shadow of my old self that people that knew me before could pass me without recognizing I was the one. So that one also piled up a lot of curiosity on my mental health. So
that sounds very, very difficult.
Yeah.
And this was what I'm finding very interesting is this issue of stigma, because we talked about it before, and I said, I am very shocked that anybody would be stigmatizing anyone with thyroid disease. Why would there be stigma? So can you share a bit more about your stigma?
As soon as they see swelling on your neck, everybody will avoid you, thinking maybe if I come close to this person, that she is going to infect me with this thing she has. That one was so much. Even when that time when you want to enter a bus, people will just be shifting for you. They would like to sit near you. Yes, they would like to sit near you. Even in my office, I was just given an leave of absence to go and take care of myself, that I was not representing the company in a healthy way. So the stigma happens in the family, it happens in the church, because people will be looking at you. What's going on? As if you're carrying, you are leprous. So it brings the person, it used to bring me down to depression. I used to be depressed because of all this, because it made me to be withdrawn. I just got myself withdrawn because I had to go on leave. I was just all alone in my house. Even at home, my children had a share of it. Because of all those stigma, it made me to become so irritable that anybody around me, I won't be comfortable. You too, you will not be comfortable. So it was a very terrible period for me. That was why when I came out of it, I knew that a lot of people would be going through what I went through because my own I had it for a stretch of 6 years before I was diagnosed and treated. Because the swelling I was even talking about came out after like 4 years before I started looking for where to get proper treatment. It took me another 2 years to be diagnosed and treated, and I had my surgery. So it was
I thank God you're much better now. Esther, can you tell us, Mrs. Esther, did you experience stigma too?
Yes, the stigma I experience is anytime I go out, people see my neck, they will just be looking at me. And it brings shame. Anytime I go out, I feel shame, I feel shy. I always cover my neck. I can't go out without covering my neck. I will wear something to cover the neck because the way people will be looking at me. Even somebody told me that thing I'm carrying on the neck, that is not an ordinary person that carry it, that they used to put it on somebody. That
Wow.
is spiritual, that they put it on me. That and I should not say because they will call me to go for surgery, that I should not try it too. That is spiritual, that I have to do spiritual things to make it disappear. That if I go for surgery, I will die.
It's terrible.
That was
thank God you went for surgery and you are fine now.
I survived. Yes.
So
I survived.
Please, I want you to tell the people out there who have something like this, that they have deceived them with these bad words. Please tell them what to do.
I am going to tell them the same thing that I was told last year that made me to go for surgery. I was scared that if I go for surgery, I would die. Then, when this type of program came last year, we were taught, if you are scared, because if you go for surgery, you will die, this thing will eventually kill you. So it's either you go for surgery or something will kill you. Then choose one. That was how I now made up my mind that last year that I'll go for surgery. And I discovered that to God be the glory, the hand that handled us was is a very perfect person. The doctor that handled us. So I went in, all of us that went in, we came out, no casualty, no complication. We were 40 in numbers that went through that surgery.
That's fantastic. Thank God. And I thank God because both of you are looking beautiful now. Unfortunately, the time is fast spent and we don't have much time. So I just want to give Prof an opportunity to say a few last words to our listeners. Prof.
Oh, thank you very much. So the fear of surgery is one of the things we find out when we do the study. Why people come so late with a big thyroid gland in their neck after we have been managing it in our hospital for more than 40 years now. Why do people still come late? So what we found was that people are afraid of surgery, apart from lack of poverty. We can put that. But importantly, the people who come early to us are those people who have thyrotoxicosis, because their own thyroid disorder is not just about the swelling in the neck. We know for swelling in the neck, a woman can start wearing turtleneck or can cover it up. But when all these symptoms that our sisters have mentioned set in, that make them to come to the hospital. What is now important is that the doctors also should not forget that thyroid disorder can manifest in various ways. We have seen two methods by which it's manifested in our two sisters, so that they will be aware and quickly nip it in the bud. I have a story of a young man who went around for almost 2 years as well before a doctor was able to think about it, that this may be due to thyroid disorder. So treatment is not only surgery. Initially, we treat them medically with medications, because we have to bring down the hormonal level before we can even do surgery for them, if it is surgery that will cure them. There are some that when they come early and they are small, after giving them the medication, you can send them for radiation therapy, where they will swallow some tablets, they will put in isolation, and those special radiation tablets will destroy the thyroid gland without surgery. So people should come. They should not delay because of fear of surgery. What is important is to go to the appropriate person, appropriate surgeon, who will do it for them properly.
Oh, thank you so much. And I think it's important. I think what has been shared today has come really straight from the heart. And I think anybody who is suffering from it now would know that now is the time to go for surgery, go for treatment. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.